Hey guys, it's that time of the year. Everyone wants to go out into the pool. If you're a dialysis patient, you definitely can do this. You just have to follow some rules. One, if you're a hemodialysis patient with a CVC, you cannot go in the pool. I'm sorry, but it's too high of a risk of infection. That CVC goes straight to your heart. We don't want you to get an infection in your heart. Now, if you have a fistula or a graft, or if you're a PD patient, you definitely can go swimming. Don't be afraid to swim. Don't be afraid to get that catheter wet. If you're a PD patient, you just have to follow some rules before you do it. Number one, you can only swim in the ocean in private chlorinated pools. That's it. So if I had a pool at my house and it had chlorine in it and I invited some people over, you can come and hang out in the pool. But if I invited 100 people over, you cannot hang out at that pool. No rivers, lakes, streams, water parks, anything like that. Only the ocean and private chlorinated pools. Now let's show you how you can swim with a fistula, graft, or a PD catheter.
So we all know by now that I'm a PD dialysis nurse, so let's start with PD. So this right here is called Tegaderm. This is the best thing to do to cover your exit site and your transfer set. This piece right here is on Amazon. I don't have enough followers to send you guys my Amazon link, but I'll post it somewhere in the comment section. This is really good. It's very easy to put on. And there you go. You just peel that off and it's almost transparent with your skin. Look at that. The easiest thing to use. Now, Baxter does provide Tegaderm for you Baxter patients, but it's nowhere near as big as this. I recommend getting this from Amazon. Now, for you fistula patients, you can go ahead and order some Tegaderm from Amazon as well. And what you would do is unravel it and cut the piece that perfectly fits your fistula. So we're going to focus on the areas where they actually stick your fistula to start your dialysis treatment. Remember, your fistula goes from your wrist all the way to the top of your bicep. So it's pretty long, but the area where they stick the most is where we're going to focus on putting this Tegaderm. So very simple to use. He's sticking it on right now. So he's going to take off the back piece so that can actually stick to your arm. And then he's going to take off the cover piece. So it's going to be transparent and perfectly blends in with your skin. Now, after PD or HD, after you put this on, when you're done swimming, do exit site care, do fistula care, clean your site. So this is something that I don't recommend getting for PD patients. You see that square right there? That's an antimicrobial cube. You don't need all that. If you use your antibiotic cream that your nurse provided for you, then you should be fine. You don't have to worry about buying this kind of Tegaderm because, first of all, it doesn't even cover your transfer set. It just covers your exit site. You also have to cover your transfer set, but this doesn't cover your transfer set. So don't buy this. Buy the big ones that I showed you earlier. Those are the best ones to buy.
All right, question number one. Can you apply Tegaderm dressing to your CVC and swim in the ocean? No, CVCs do not go in the pool, do not go in the ocean. We do not get that wet. Question number two, where can you swim if you're a dialysis patient? Private chlorinated pools and the ocean. No splash pads, no rivers, lakes, streams, ponds, no water parks. Question number three, what's the name of the dressing that you should apply to your exit site or fistula or graft before you get into the pool? Tegaderm. That was kind of a hard one, but it's called Tegaderm. And after you're done swimming, question number 4, after you're done swimming, what should you immediately do before proceeding with the rest of your day? That's right, exit site care. Clean your fistula, graft, or your exit site the appropriate way that your nurse and doctors told you. That's pretty much it. I clearly have lost my voice. Enjoy the 4th of July. Enjoy your weekend. Enjoy your summer.